we looked at delinquency, their self-report, and we found that all youth showed a significant decrease in rearrests and in self-report delinquency. So again, in the early phase, drug court phase, everybody's doing better. They're reducing their drug use, they're reducing their delinquency, they're not getting arrested, 79% reduction in arrests, because all these kids were arrested. That's how you got into drug court. So there are no difference between the treatments at intake to 6 months, the drug course. Everyone's doing great. Okay, that's what we expected. But what happens as you move on? And that's where we see the differences, where the MDFT kids do better in, maintain their treatment gains better than the kids who got the group and individual. If we look at drug use, we have 3 different measures. Frequency of use, you get actually a 48% decrease for MDFT from intake to 24 months and a 43% decrease for group, which is still very good. So just to remember, at intake to 6 months, it was like a 78% decrease. And then if you look at intake to 24 months, it's 48. So they increased their symptoms a bit in phase 2. Everybody did, but still way lower than baseline. If we look at drug use problems, there was a 19% increase for youth in group, only an 8% increase for group kids in MDFT, and urine screens, and there was a 15% increase in positive urine screens for the group, and the MDFT, at least according to this measure, continued to decrease in the follow-up phase, so which was unusual, 8% decrease. So all in all, you look at it, MDFT is producing better long-term results. But drug courts, there's a measure, a self-report measure of really bad crimes, right? Rape, aggravated assault, murdering somebody, stealing a motor vehicle, really bad stuff. And the MDFT report fewer of these offenses than the other group. So when we look at this, at self-report, in the follow-up phase, the MDFT on the 2 measures, externalizing symptoms and the serious crimes, are reporting significantly fewer of these things than the group, which is very impressive. But that is not all, because we also looked at arrest records. And we found in comparison to the drug court phase, for all use, there was an increase in arrests, right? Kids are, doing more stuff in 6 to 24 months than baseline to 6 months. But youth in MDFT had a significantly lower rearrest rate for those felony charges. 27% of the MDFT youth were arrested for a felony versus 46% for group. So you have that consistency of self-report and arrest data, right? The same thing with the MDFT kids committing significantly fewer of those more serious crimes and having less arrests. So that's pretty impressive for us. This is where we compared MDFT to residential treatment. Children were approved for residential treatment, were recommended to go, and they were randomized to MDFT as an alternative to residential treatment or residential. And I want to go through this because I think I heard in the talk this morning that a fair number of your kids are placed in out-of-home care. And I want to suggest MDFT in the drug court, or MDFT in this way is an alternative to residential treatment. Let's look at the cost in this study. Because residential treatment is so expensive, we thought if we in MDFT could do as well as the residential treatment, then we're a winner in a sense. Then, well, let's put kids in MDFT because it's going to cost less. So we did a little cost analysis, and you can see this is in the U.S. in Miami, I guess. It was $384 a week for MDFT, over $1,000 a week for residential treatment. In residential treatment, it's very expensive wherever you go. And in this study, we also divided up into phases: intake to 2 months, and then 2 to 18 months. again with the idea, our hypotheses were that in the first period, the 2 months, that the kids in residential treatment, because they're in residential treatment, would do better than MDFT, because the MDFT kids are still out there getting in stuff right. They're going to use drugs more, they're going to commit more crimes. We just thought that it would be in after 2 months that we would see the payoff. So there would be some risk, right? Because these are kids who everyone thinks for their own well-being and for society's well-being, they have to put being out of home care. Our community said, all right, let them be out there, but we all knew there would be more risk. Well, we were wrong in that in the early phase, the MDFT kids and the residential kids did equally well. The residential kids did not do better. So we looked at substance use and externalizing symptoms and behaviors. Both were reduced. And actually, this is sort of interesting, I don't know what, but the MDFT kids even reported a greater decrease than residential in internalizing symptoms of anxiety and depression. Go no. Here's an example of the change in drug use frequency in those first 2 months. The residential, of course, we knew that would go down. They're in a controlled environment, but the MDFT did too, which was a surprise to us. So it's possible to keep kids and society safe, even in the very beginning, by putting kids in MDFT instead of residential. Then, of course, we looked at the long term, 2 to 18 months. And we found that in substance use, MDFT youth maintain their treatment gains, better than kids in residential. With externalizing, MDFT youth maintain their treatment gains on delinquent behavior. They maintain their treatment gains, where the residential kids, over time, they start to increase. They didn't maintain their treatment gains. They increased their delinquent behaviors. We found no differences on internalizing over time. Both treatments maintained their early gains. And in school functioning, we found MDFT showed decreased absences and reduced suspensions over time, while the residential kid had an increase in absences. So basically, MDFT is maintaining their treatment gains better than the residential treatment. And here's a little school. You can see it sharply there. This is school absences. This is a residential, going up, right? Treatment was about 6 months. MDFT struggles a little bit in the beginning, but then on this beautiful trajectory. Same with school suspensions. Here's your residential kids, not so good. MDFT, continue. And I have to stop now. I think the take-home message is that in these numerous studies, and there's more ongoing, MDFT consistently shows to be better than the alternative treatment. It reduces a host of symptoms, improves school functioning, improves family functioning, reduces depression, internalizing disorders, drug use, externalizing disorders, criminality, and it seems like the results last over time in comparison to the best alternative treatments. And for us, that's the best finding, because that fits with the theory, right? The theory is that if you change the family, you change the parents, how they parent, how the kids and the parents talk to each other and solve their problems, then they can maintain their health of their family without all of us professionals, right? It's like the therapist, the family and the parents, they become the therapists, they become the healing force. And I think that's what you see by, again, the sense of almost any good treatment is going to reduce symptoms and problems while you're in treatment. But in the long haul, what's going to work? Well, if you can change that family enough so they can take care of themselves, which is, I think, what we do in MDFT, then that's going to have a big payoff, because those kids aren't going to have to come back to treatment so much, and they're going to be on a healthy trajectory. And they don't need to see us, right? That's what we want. We don't want them to see us again. Thank you.